To many Kenyans, being diagnosed with kidney failure has for decades marked the genesis to a torturous journey. Besides the expenses involved during treatment, many are forced to travel miles away to look for a health facility with such services. But for this couple, Mr. and Mrs. Toh from Nakuru County, theirs has been more than a torturous journey.
I didn't know at one time also, I'll come use the same machine we are seeing here today.
It all started late in 2007 when Mrs. Toh started experiencing various symptoms, and after numerous tests that even involved a biopsy, the specimen was taken overseas for advanced testing. The results which came back were heartbreaking.
Leo uko mzuri, labda jioni uko mbaya. Wakati alipima akaniambia hii ugonjwa imeanza kwa sababu ya cholesterol ilikuwa mingi kwa mwili.
And for the past 10 years, she has contracted many diseases in the process of her weekly dialysis, which she has done religiously, some which she had never heard about before.
Nikapata ugonjwa ingine ambayo inaitwa hepatitis C. Hiyo sasa sijui nilipata hata siku ya kwanza sikuwa na hizo.
Her fears are palpable as she relives the journey that has retested her resilience, a condition that has made her lose her parental obligation as a mother to her 3 children.
I just felt so bad. I felt so bad.
Despite the routine, every 4-hour session could be his last. But what really causes kidney failure?
About 60% of the patients that we dialyze in this country is due to diabetes. Hypertension follows closely after that.
The situation became worse this year in June when Mr. Toh was also diagnosed with the same condition that her wife had been suffering from.
I can't even comprehend really how can such a thing happen. Same family, kidney failure, the wife, kidney failure, the husband, who to assist who now? So I saw I was not able to manage to take care of my wife, my children, and again work. So I opted to leave work for my family.
Pensively, Mr. Toh sits at the machine as the dialysis continues, with his wife also deep in thought a few meters away from him. The Tohs can't do most of the things they were able to do, such as walk for a distance, sit, or sleep for long hours. Even as they keep their eyes fixed on the ultimate prize, which is a kidney transplant, Mr. Toh is a bit skeptical after the first transplant attempt on his wife failed.
Personally, I have some potential donors who can do that. But the biggest problem is finance.
Tukafanya ingine tena, hatukufaulu. Ingawa ndugu yangu alikubali akanipatia anipee kidney nyingine.
Currently in Kenya, only Kenyatta National Hospital, Moi Teaching and Referral Hospital, Nairobi Hospital and Aga Khan Hospital offer these services. Public hospitals charge the least at 500,000, with private hospitals charging between 1.5 million to 2 million Kenyan shillings. The burden is at least reduced with the government subsidizing this through NHIF, but this is still not enough for Mr. and Mrs. Toh. They need an upwards of 45,000 for dialysis sessions every week, the cost of medication not included.
Hata siku ya kwanza sikuwa ninajua itakula pesa hivyo. Nilikuwa nafikiri ni kitu ya naenda tu alafu itafika muda alafu inaisha.
So we need to do 4 sessions in a week. So you pay the difference, or you go to 1 session for a week.
The new health law, which builds on the Human Tissue Act of 1966, which came to effect in June, Kenya became the second country in Africa after South Africa to legalize disease donor transplant or cardiac donation for transplant and research.
Nairobi Hospital, we offer kidney transplantation locally. You know, and that is in contradistinction to what we hear that our patients, fly to India and escape to India. Quite a number of kidney transplants are done locally.
Sickness equalizes all of us, however, money separates us. Mr. and Mrs. Toh are seeking aid to help them settle their ever-accruing medical expenses. You can contribute on M-Pesa number 0711 582705 or paybill number 169140, account name Toh. It has been 10 years since Mr. and Mrs. Toh first heard about kidney failure, a condition which was worsened this year when Mr. Toh was diagnosed with the same condition. They're now forced to come to this dialysis machine after every 3 days for dialysis to be done. They're now appealing to well-wishers for help as their financial coffers are running dry. Ouma Onyango reporting for Health Talk, KUTV, Nairobi.